Hello, everyone. Welcome to Health IT Matters, a podcast in which we explore the ways health information technology is transforming healthcare locally in Florida and on a national level. Health IT Matters is recorded live on the third Thursday of each month and explores the many facets of the ever-growing health IT spectrum. I'm your host, Corinne Slaughterback. I would also like to introduce my colleagues, Pam King and Kim Davis-Allen, who will be leading our discussion today. Pam is the Health IT Outreach Coordinator at the Agency for Healthcare Administration, and Kim is the Outreach Coordinator for Florida's EHR Incentive Program. In today's episode, Pam and Kim will be speaking with industry leaders about the evolution of health IT and emergency response. I'd now like to introduce our panelists. In alphabetical order, we have Dr. Kim Landry. Dr. Landry is board certified in both emergency medicine and the subspecialty of EMS. He has over 24 years experience working in emergency departments and over 23 years experience working as an EMS medical director for multiple EMS and fire rescue agencies. Dr. Landry is an associate professor of clinical medicine at the FSU College of Medicine, as well as president and CEO of Excalibur Telemedical Services Incorporated, offering emergency physician telemedical services to EMS and other industries. A fun fact about him is that he is an inventor and in his spare time draws medical cartoons. Next, we have Mandy Manzi. Mandy has been employed with the Florida Agency for Healthcare Administration since 2007. She has worked in various positions and capacities, including application processing, agency initiatives, training, emergency management, and system development. Mandy is currently the business lead for the Emergency Status System as well as other agency systems. A fun fact about Mandy is that she has been part of 2 system development teams that have received recognitions, one statewide, ESS, and one nationally, the Background Screening Clearinghouse. Last but not least, we have Dr. Suzanne Cryolu. Suzanne is a former U.S. Navy supply officer and received her doctorate degree in political science from Florida State University. She received her bachelor's degree from Clemson University and remains a die-hard Tigers fan. Suzanne has 7 years of clinical and health IT experience, and a fun fact about Suzanne is that she was the first female rescue swimmer in the 7th Fleet, and she is also a hacky sack and pickleball enthusiast. Now, before we talk to our panelists, I would like to give you some quick contextual information. On September 11, 2001, airliner attacks were carried out against targets in the United States. 2 planes were flown into the World Trade Center towers in New York City. A 3rd plane hit the Pentagon just outside of Washington, D.C., and the 4th plane crashed into a field in Pennsylvania. The events of that day resulted in several emergency response efforts we implement today, including FirstNet. FirstNet grew from a recommendation made by the 9/11 Commission into a vision championed by public safety for years. That vision was advanced by Congress and carried out by the First Responder Network Authority, which was established in 2012. Based on state and local authority input, a contract was entered into with AT&T in 2017, and now, with all 50 states, 5 territories, and DC on board, it has become a reality.
Dr. Landry, I'm going to start with you because as an emergency physician and a medical director, working with ambulance services and emergency management services, you have a lot of knowledge about FirstNet. I can remember you sharing information with me about FirstNet years ago. And so I just want you to share a little bit more with our audience about what FirstNet is and how it works.
Okay, well, a good way to look at FirstNet, and I'll use the analogy of an interstate highway. If you can imagine the communication highway, which includes cell technology and Wi-Fi technology. If you have a 4-lane interstate going 2 ways, traffic flows very smoothly to and from a given destination. And in the communication world, that technology basically operates that way. Along the cell towers and the communication networks, traffic flows relatively smoothly. But when it comes to peak time, the congestion on the highway can be such that traffic comes to a complete standstill, and basically the forward movement of traffic is hampered by the congestion on the highway. Same thing happens on communication networks. When the communication networks become overwhelmed with people trying to access cell towers and the communication networks, it can slow the communication back and forth. And unfortunately, that's what happens in times of disaster, particularly in events like after a hurricane or during a hurricane or any natural disaster. People are flooding the communication highway, attempting to make calls in and out of a disaster system to report disasters, check on relatives, or whatever. And unfortunately, before the FirstNet system came in place, the first responders, all emergency communication was along that same highway. So we had to compete with the same general public, trying to access a tower to communicate with first responders that may be trying to get to the scene of a disaster or on scene of a disaster. And the communication became hampered to the point where at times you lost communication with your field units. So you had no idea if they needed additional resources or what have you. So FirstNet basically is equivalent to a fast lane, and only first responders are allowed in that fast lane. So during the time of high use and high congestion, where the general public may be hampered with accessing cell phone towers and using communication streams, the FastNet is basically a lane that's open for rapid transition of communication to and from for first responders. And so this became very important and very beneficial, particularly after certain disasters. So it incorporates the use of separate cell towers or specific cell towers, specific bandwidths, satellites, drones, and there's a number of components to this FirstNet that opens the lane and isolates a bandwidth of traffic for first responders to use during an emergency situation. So it basically has helped tremendously, and we were able to see that in action after a particular, for example, Hurricane Michael, when it hit Panama City.
It seems like I remember seeing mobile cell towers or mobile satellites coming in. Was that part of the FirstNet?
Yeah. So what happened, and interestingly, in Hurricane Michael, there was some significant damage to the infrastructure. Actual cell towers were severely damaged and rendered useless. So we had no communication to communicate with our field units. And ambulances were literally dispatched with sticky notes, where someone would receive a call, and the calls were received in the oddest ways, where people who did have access to an internet would FaceTime a friend out of town, who would then post it, and it was picked up on a post on somebody's Facebook that an ambulance was needed at a given location. And so the address was written on a sticky note and brought out to the parking lot where the ambulance was dispatched, basically from a sticky note. And from that point forth, we had no idea if they made patient contact, where they took the patient, because we had no communication. And when we recognized this problem was widespread, the FirstNet system brought in multiple satellite phones, and they were able to bring in cell towers. And basically, they call them COWs, cell towers on wheels. And when you set one of these up, it offers a range of about 5 to 6 mile radius of internet service. And so you would have to have multiple of these cows set up in order to have a contiguous communication stream. Well, then they started using drones where you could tether a drone and send up a little higher, and that afforded about a 10 to 15 mile radius of communication capability. So it's getting better and better in our ability to be able to keep track and utilize our communication during time of disaster for dispatching first responders and keeping track of first responders. And the bandwidth is such that you could utilize telemedicine where you could transmit a large amount of data over this bandwidth and communicate directly with patients in the field from a hospital setting or from an EMS perspective. From the medical director could communicate direct with patients in the field, and it worked very well after Hurricane Michael. So we know that the continued growth of this process is going to make it even more efficient and effective for us to respond to the needs during a disaster.
So, I mean, I have so many questions here, but the use of drones and cows, I love that. So as you look at the lessons learned from each experience, I guess each disaster, what kind of things are going to be happening in the future to improve on this service? Or what do you see still needs to be done?
Well, they're going to be adding resources. A lot more mobile stations will be deployed at some of these disaster settings. The capability of using more drones to cover and expand the use of the technology so that there's uninterrupted transmission between dispatch center and the field units, and the capability of these ambulances to communicate with hospitals and other healthcare agencies, shelters, etc. It's just going to ever improve and be able to expand the use of this technology to be more effective during a disaster. It's important to know when hospitals get overwhelmed that we may have to divert patients to another facility. And it's just a constant communication between the call center where calls are received, the first responders, including fire departments, law enforcement, ambulance personnel, hospitals, shelters. All these systems need to be able to communicate flawlessly between one another, so we know the best place to take patients and be very efficient and effective in dealing with the disasters and the high volume of call that's come in during these disasters.
I can see where that was, especially, I mean, because you're up around the Big Bend area, you're in Santa Rosa and Leon County. You do a lot of work in the Panhandle area. And so Hurricane Michael, I mean, you had two hospitals that the hospitals in the city were damaged. So knowing where to take patients after that and transporting patients from the hospital as well as new patients to other facilities, I'm certain that those communications were super important, being able to communicate between all of those resources.
The initial response was very difficult because of we didn't really know early on the extent of the damage to the network, the cell towers and stuff. But once we recognized that and were able to bring in FirstNet and basically utilize satellite phones and technology, it was a 180-degree turn in terms of our efficiency and our ability to recognize which hospitals, what patients needed to go to what hospital, and sometimes this entailed 2 and 3 hour transports and the use of multiple helicopters to transport a lot of these patients out of the disaster zone.
It's so amazing to me. I mean, I think about if we didn't have this technology, what could have happened?
We would have probably run out of sticky notes.
I'm sure. But actually the ability to get to those patients, having that capability, I'm sure saved a lot of lives. So real grateful for technology in those circumstances. And speaking of hurricanes and what can happen during hurricanes, Corinne, I think you're going to tell us a little bit more about some of our historical hurricanes.
Yeah, so speaking of hurricanes, The 2004 hurricane season was an active one, to say the least. There were 15 named storms, with 9 that became hurricanes. 4 of those hurricanes, Charlie, Francis, Ivan, and Jean, all took aim at Florida during a 6-week period. Each one was different, yet each served as a reminder of what these storms can bring to those living or vacationing in hurricane-prone areas. Nearly all of Florida was impacted by the storms. Numerous tornadoes were recorded, storm surges, and widespread flooding. The 2004 and 2005 hurricane season impacted hundreds of thousands of people. Many people were displaced. They were separated from their healthcare providers, and medical records were lost due to the use of paper records at the time. Florida's Emergency Status System, or ESS, was implemented between these 2 hurricane seasons. The web-based system enables reporting of emergency-related information from health facilities to the Agency for Healthcare Administration that had been traditionally collected through phone calls and fax responses.
I will start with a question for Mandy about ESS, and I know this is the area that you definitely work with, and apparently received a recognition for your work with implementing the system. So we probably talked a little bit about Hurricane Michael, a lot of publicity around Hurricane Michael, and so other than the obvious from 2004 to the last hurricane season, kind of tell us more about the ESS system and how the need the agency saw for this web-based system. It is a web-based system, correct?
Correct. So this system was developed out of a huge need to have one central location to collect all this data about our residential and inpatient providers. Because before ESS, it was pen and paper, and then it was Excel on individual staff computers. And then it was an access database that collected all the information. It was data entered into after reaching out to the providers. And now this is the second iteration of ESS, but it's similar to the first, where it's now web-based. ACA staff can use it, but providers can use it themselves and report in their information. So their phone's not ringing off the hook if their phone's even working.
Mm-hmm. What types of information is collected?
So the way this system works, there's 2 parts to the system. The first part is where the providers can put in some of their preseason information, or their as in the biz, it's called blue sky information. So it's their standard stuff, what kind of generator they have, who to call if we need to reach out to them, what agreements they have in place for evacuation or transportation. A lot of this stuff is in what they would call their CEMP, their Comprehensive Emergency Management Plan. And this is just a system for them to put that information into, so that we have access to that when a situation occurs, and if we need to get that information for purposes in relation to them being impacted by a disaster. The other half of the system is actually only activated if there is an emergency or an event or some type of disaster that facility's location is involved in. And then they would report in such things as how many patients do they have, if they're evacuating, if they are, where they're going, if they have any damages or anything like that. If loss of power, that was a big one from Hurricane Michael. That was one of the main things we collected. So those types of information, and we use all of that information and we share it with our partners so that we can jump into action in some fashion depending on what's going on.
So you're able to take the information that facilities put into the system and use that, whether it's that static information on who to contact for that facility, or information they input during emergency to assist them in operations if need be.
Correct. So the biggest example, Hurricane Michael, because it is the most recent, and it was very large, and it was actually the first time that this version of ESS was utilized. And we were able to have the providers put in their electric company during preseason. And I use that word loosely right now because we stood up ESS and then had Hurricane Michael within I think it was like a month or two from when we stood it up to when we had to use it. So we had their electric companies and their account numbers, because that's part of that preseason information. And then when Hurricane Michael hit and took out all that power, we were able to take that information and then them inputting that they had no power and run reports for each of the power companies to tell them these are our healthcare providers that are reporting out of power that fall within your purview, and get those lists out to them, and then they could do some type of prioritization to get those restored and give us updates on them daily. I think that's the best way to explain how we utilize the data.
Oh, that's wonderful. That's amazing. And so how is it different now compared to the way it was before? What is the difference in the system?
So the original ESS had limitations. There was only certain things that we could collect regarding the data elements, and it wasn't as intuitive as this system is. With the current version, we can ask a question, and then depending on your answer, ask a bunch of follow-ups.
Okay.
The previous system was limited for the number of users for each facility, where they could have one or two. Now they can have as many as they need. And that came in very handy, especially during COVID, when there was a lot of burnout and they just kept transferring the duties to other people since they have to report in every day. And our partners are able to utilize the system, not just our Department of Health, which is part of our emergency support function, but other agencies as well. And on federal, state, county, city, all of those, they all can gain access to this system and to the data and use it. And that was not something that we were able to do in the previous version of the system.
So I had a quick follow-up. Was it also used during the COVID response?
Yes. So during COVID, see, the majority of the system is geared more toward like quick disasters, for lack of a better word, where like a hurricane comes and then it goes. Well, COVID never left. So we actually did a bunch of system development in the month of March and a bunch of improvements. So now we have a module in there where we can ask anything we want. We didn't have that before, and that's what we've been using for COVID, because as the situation developed, it changed the data elements and the pieces of information we needed. So we've changed those questions tons of times. As if there's any providers listening, they know, and they're shaking their head because we changed it so often on them because the situation kept changing. Now, thankfully, we haven't changed it in probably a couple of weeks, but it's still a number of elements that they have to report in. But that now gives us this module we can use anytime that there's something that we need to know or collect that isn't built into the system. We can actually create that and ask it on the fly.
So it's become more flexible.
Oh, yes.
Depending on the situation. And so hurricane season is coming up. You're still collecting information about COVID, right? Through the ESS. How should facilities handle that and having their information and getting their information in the system? Are there things they need to be aware of and prepared for?
So as of right now, yes, we still have the COVID event open and they're still reporting for that. And if I'm going to knock on wood right now, or fake wood, if there were to be a hurricane to come up soon while the COVID event is still open, we would send out communications telling them that they should be filling in the other information that's more hurricane related, because as it is now, they fill out 2 sections of the system instead of all of them. And then we alleviate that need when that disaster has passed. So just, make sure their emails are up and functional and correct in the system. Make sure they have users in there, because there's a lot of our facilities, some of them are on the smaller side, so they have one person. And ideally you have more than one, so that if there's that burnout or if that person can't do it, someone else can step in. Because we do have situations like that. So we really want people to have as many users as they want, but as many users as they need as well, because they may want one, but they may need 2 or 3, and they can do that at any time. And then I know we just sent out some communications to make sure that their preseason or blue sky information is up to date. And that's something critical as well. If something were to happen, we would like to have that base knowledge to use going forward if we need to jump into action.
For those people that are with facilities joining us today and they haven't gotten that letter, that preseason letter that you mentioned, where can they go to get a copy of that?
So ACA does have a webpage that is called the Emergency Preparedness Resources webpage. And right now, if you go to ACA's main website, aca.myflorida.com, there's actually some rotating banners going on. One of them will take you to a COVID page. There's another one for ESS, and you click on that, it takes you to that Emergency Preparedness Resources page. I suggest you bookmark it. It has more than just ESS stuff on there. And then there's also another banner. It has to do with the generator dashboard that we just rolled out, the improved one that just rolled out last week, I think. So we have some banners going on now, but don't rely on the banners. Go to the pages now, bookmark them so you have them for future.
And that emergency, I'll take, I'm a little biased because I, of course, work with the agency too, but it has some really good emergency preparedness information on there, not just for facilities, but for individuals as well. So anybody listening, I would recommend going out, checking out that page. It's got some really good resources for folks to help prepare individually for hurricane season, as well as for facilities to prepare and to help prepare their residents for hurricane season coming up. ESS demonstrates the benefits of having data that can be used to assist during public health emergencies and the technological advances that increase support of data analytics. So talking about that data analytics and the use of data, we want to also get into a conversation about a service that's called Emergency Census.
The 2017 hurricane season was a shock to the Florida Peninsula after 12 years of relative calm. During prior hurricane seasons in those areas, Hurricane Irma entered the Keys and traveled up Florida, impacting both coasts. Then in 2018, Hurricane Michael transitioned from a Category 2 to a Category 5 storm overnight and made a catastrophic landfall near Mexico Beach and Tyndall Air Force Base. Michael produced devastating winds up to 160 miles per hour and storm surge near the coast, rain, and wind inland. Scores of people were missing for weeks in the hardest hit areas. The development of the emergency census in 2017 marked a turning point for hurricane response efforts in Florida. Emergency Census uses the Florida HIE Encounter Notification Service, or ENS, as a base of information on patients being admitted to healthcare facilities.
So we're going to talk to Suzanne a lot about emergency census. So just tell us a little bit more about what it is and how it is being used.
Sure, Kim. First, I just want to say, thanks for having me here. I'm happy to be here and also listen to the great things Mandy and Dr. Landry have discussed. So I think to begin this conversation about emergency census, I really just want to first talk about the Encounter Notification Service, which of course is built on top of. So the Encounter Notification Service is a statewide alerting service. What it does is it alerts providers and health plans when one of their patients or members has had an encounter at a connected healthcare facility. So for example, let's say you're admitted to the hospital and your provider is subscribed to ENS. Then the minute you get admitted, an alert is sent to ENS. That alert then is redirected to your provider, and it allows the provider then to help, coordinate your care, perhaps, contact you, give you any education you need, that kind of thing. So it's a really excellent care coordination tool. And, as Corinne had mentioned, we started it in 2017. So really, we were like, okay, we have this system, we have this data. How can we deploy it for emergency response? Because we have a hurricane that's going to hit in just a few days, right? So that's how quickly we stood up this emergency census. So in normal times, when we get data into ENS, we don't store any of it, right? We either send it on to the provider because they matched one of their patients, or we just purge it. But for hurricanes, we realized that the minute a state of emergency is declared, we can pause that purge and essentially create a database of admits and discharges, which we can then use to search for missing persons. And just to give you some perspective, our encounter notification service is one of the largest in the country, if not the largest. And we have over 400 like acute and post-acute care providers that are connected. So we have a tremendous amount of data. So it was really, just a great tool that we could use, and we were, thrilled to be able to leverage it to help emergency responders. So that's basically how emergency census works.
And Suzanne, we've been talking about Hurricane Michael, but I know emergency census was used after Hurricane Michael. Can you tell us a little bit about some of the results of that?
Oh, of course. So, I'll say each time we deployed emergency census, we got some experience and we had some lessons learned, and it was like each time we then said, what can we improve upon? What was good? What was not good? And for Michael, I'll first talk about just, the fact that this was what I'll call the first generation of emergency census. And when I say that, I mean, we've enhanced it now, the technical aspects of it to make it better. But at the time, it was extremely labor intensive. And so what I mean is, we had handwritten lists of people who were missing that were faxed into us from agency staff, who had been visiting healthcare facilities, and they've lost some of their patients. And so we were getting these faxes in, right? And then from Florida Health, they had like a public facing, web portal where people could go and type in someone who they love and they're missing and just type all that in. So we had gotten that data as well. Well, the problem is E&S needs a very structured format to be able to read and digest the information. And so none of it was coming in that format. So it required a lot of back-end data manipulation. And on top of that, it was sending, personally identifiable information. We had to encrypt it. So there were a lot of email messages coming back and forth that were encrypted, a lot of phone calls trying to coordinate and then send it to the right people, let them know. So that was something we learned with Michael. But, although it was so labor intensive, it was still an extremely wonderful success. We had over 5,000 patients that we uploaded into the emergency census. And within the first hour, we found 400 of them. So, I think all in all, we found over 500, and they were mainly dialysis and home health patients, whose providers had lost them. So we were able to reconnect them. So it was really great, So yeah, that was our experience with Michael.
And that was with a primarily manual process as well. I just kind of want to point that out. So tremendous impact.
Oh yeah, it was all, we had to type everything in. And so, because of that experience, we set out to enhance the system. And let's see, September 2020, we finished those enhancements. I can go ahead and talk about some of them now. So for one, we didn't have a great user interface. This was all just spreadsheets kind of thing. So what we did was develop a user interface that a person who is the one looking for the missing persons can go to, and they can see, like, there's 3 columns. It's really simple to see, like, here's your first column. This is everyone who's been admitted to a hospital or a skilled nursing facility. The second column, this is everyone who's been admitted to an emergency department or an alternative care site, such as a special needs shelter. And then the third column is like, here are all the recent discharges. And what's great, is it has that encounter notification or the encounter data in it. So it also tells you their discharge, disposition. So they may have gone home. Maybe they were transferred to another hospital or something like that. All of that information there is just easily viewable in this user interface. Another thing we did was, like you were saying, how manual everything is. We had to do everything, type everything in to get it into the system. Well, we created a way now that we can not manually, but like electronically input like those lists of folks who are missing, and it's all structured already. All you have to do is type in the name and just click a button, and you've got it uploaded. And the final piece of it, which is really great, is we have enabled alternative care sites like the special needs shelters to provide encounter data to the system, right? So now in this way, we're expanding the like searchable domain of admits and discharges. Right now, we can look in the hospital, we can look in the ED, we can look in a skilled nursing facility. Now we can also look at any shelter that's connected to emergency census or any type of alternative care site that has it. And so not only does that give us more, searchable database, but it's also then going to trigger any provider or healthcare plan who's subscribed to ENS. Then they'll know, oh my God, John's in the shelter. Okay, now we need to know. And, so then they'll also be notified when he's discharged, and then they can go follow up with him, make sure, everything's okay.
And, Suzanne, you talked about a couple of different things that I know that the emergency census, now that it's more automated, is really kind of tied to two of the services or two other technological services that are out there. And both of those we're going to talk about, but one that I want to get more information on from you right now is how it uses, you talked about it using the encounter notification service as a base of information on patients and being admitted into healthcare facilities. And really there was a use for that during the COVID-19 pandemic.
The COVID-19 pandemic swept the world in 2020. Protocols in response to this were put in place, including mask mandates, prohibition and cancellation of large-scale gatherings, stay-at-home orders, and school closures. The ability for healthcare entities to know the status of their patients was even more prevalent during this past year, and the Florida HIE's Encounter Notification Service was one tool that healthcare organizations used to assist their patients.
And so, Suzanne, you have kind of given us a basic idea of how ENS works. So kind of expand on how it was or is being used to support the pandemic.
Sure. Yeah. Like you're saying, it's still currently being used to support the pandemic. I'll start with how we have supported our providers and health plans. We did this by using smart alerts. And what smart alerts are is ENS subscribers, rather than receiving all admits and discharge messages, they can set up a specific criteria in which to trigger an alert to them. So in this sense, instead of receiving, they want all admits and discharges, they say, I want all admits and discharges based on this criteria. It has to be set by this criteria. So, you could say, I only want alerts from hospital X. I only want alerts for patients over a certain age. So these are the ways we can configure ENS. And for COVID response, what we ended up doing was using the diagnosis code. And we would trigger alerts to providers and health plans using the ICD-10 code for COVID diagnosis or other, COVID-like illnesses. And then those would then allow the health plans and the providers, to be completely aware in real time that one of their patients or members has been diagnosed with COVID, and then B, help them tailor their response to the pandemic, because now they have an understanding of who in their population, has COVID or potentially has COVID. And the second way we used it was really partnering with Florida Health. So they have a system known as Essence, which is the electronic surveillance system for early notification of community-based epidemics. So basically, it's, a syndromic surveillance system. It's a biosurveillance system that it collects data, from all over Florida. I'll give you some of their data sources. So they get data from emergency departments, and they get this chief complaint data from all the hospitals and urgent cares that are participating. They get data from the Florida Poison Information Center network. They also get data on reportable diseases from the Merlin database. And finally, they get mortality data from the Florida Office of Vital Statistics. So all this data was helping them, do analytics, figure out whatever it is they did in response, to COVID. But they were missing one piece of data, and that was inpatient hospital data, right? So that was where we were able to fill in that gap for them. We got them connected to ENS. We give them a continuous feed of hospital inpatient data. And so that was really just able to, you know, close that gap and provide them with that more information. So those were two places, you know, where we use the encounter notification in this pandemic.
And the concept of smart alerts is really has a lot of potential in that it can be tailored to whatever the need of that particular provider, pandemic.
Yes.
We'll have another one of those. Yes. Okay. So ENS is really a great service. It has definitely grown over the years, and I see a lot of potential ongoing to meeting providers' needs.
Right. And I mean, and it's a tool that's used every day that has evolved into something that was useful during
Right.
During a crisis, right? And as we've talked with each of our panelists today, we've talked about different events and how those events really evolved into the creation of some technology, or we were able to see the need for improvements in some of the technological uses that we have during a crisis. And I know there's some things that at the agency we are working with to help us prepare for this hurricane season.
Yeah, the 2021 hurricane season is right around the corner. Compounding preparation for this year are the added complexities around COVID-19 protocols and vaccinations. The Emergency Patient Lookup System, or E+, is being piloted this year. This service will enable emergency response personnel to have access to electronic patient health records for patient care and public health purposes.
So Suzanne, give us some information about this. This looks very intriguing.
It is. It is. You know, it was really just a quick history born out of the experience with Hurricane Katrina. You know, people didn't have medications. All their medical records were wiped out. Nobody had any information. So it was really, you know, at the federal level, the Office of the National Coordinator for Health Information Technology, which is part of, you know, the Department of Health and Human Services, that was what prompted them to say, hey, how can we use, you know, electronic health information during times of disasters? And really, it took another decade for this even to become a possibility, because we were still at the beginnings of even getting our healthcare system in this electronic world, right? So we spent a decade moving people from paper to electronic health system, and then we were now able to build some of the, you know, the foundation for which the emergency patient lookup system is built on. So now, fast forward to now. So E+ is basically a web portal, and it gives emergency responders remote access to the National Health Information Exchanges. It is connected directly to the eHealth Exchange, which is a nationwide health information exchange. So you have healthcare organizations connected to the eHealth Exchange from all across the U.S. exchanging clinical records, right? So that's the system. That's what E+ is connected to. So I think what's so revolutionary about this is if you want to look up electronic patient records, you really have to have, you know, an EHR system, which means you're stuck in a hospital or you know, a provider's office, and that's how you get it. But with E+, you know, it's web-based now, so anyone with a laptop who's in the field responding to an emergency, you know, at an alternative care site can connect and get that data that they need. It's really great. It's also this past April, we've got E+ connected to another network called SureScripts. And SureScripts is basically like a health information network for pharmacies, right? So pharmacies are exchanging information. And in Florida, we have over 89% of our pharmacies connected to it. And the information that, you know, emergency responders can get from it are medication fill histories. So if a medication was prescribed and it was filled, it's in there. It also gives you refills, how many were authorized, tells you the prescriber's name, and it also gives you the contact information of the pharmacy where it was prescribed. So it's really valuable information.
And I remember back with Hurricane Katrina, even though that hurricane didn't hit Florida, we saw a lot of patients. We saw a lot of people that
Wow.
that were displaced and moved to Florida, and all of their records were destroyed. And so they didn't have that prescription information. So I can see where that would be a vital tool, even for maybe not a disaster hitting us directly, but for us to be able to help patients that would be moving here from areas that were
That's a
damaged.
great point, Sam. Exactly.
I'm sure, Dr. Landry, you remember that, since most of them probably came to your area during that time.
Correct.
And I know, Dr. Landry, that we've been talking with Santa Rosa County about being a pilot for this E+ system, and we've shown you a little bit about how it works. Suzanne has demoed that service for you. So how do you think it could benefit people in your area?
Well, just being able to track patients, and especially have the ability to look at their medical records and their medications that may be lost, or for whatever reason it's not available when an emergency occurs. Just that alone is absolutely valuable to know and understand if what we see in a patient is related to one of the medications they are missing or may be on, or related to a past medical problem that patient or family may not be able to produce a record for. It's just it's going to be very valuable in the continuity of care for patients, and streamlining what needs to be done for patients, and not waste time having to try to research to find out what's been done for this patient in the past, what medications they're on. It's just gonna be a very efficient a way of tracking everything about the patient that is needed for any healthcare individual to encounter and help manage this patient, from the onset of their registration into the system until they're discharged and put in a final residence of some type or health facility. It's just going to be, the continuity of care is just going to be tremendous in terms of easy flow and ability from every healthcare individual involved in this patient's care to utilize.
I mean, when I think about, in an emergency and people having to leave their homes quickly, I think of, those seniors out there like my parents who have to have their list of medications, right? And I can see them hurrying out of the house, not having that list and trying to remember all of those medications, how difficult that would be. So thinking of it from that perspective, I can see so many benefits of just even having that medication information for folks.
It's incredible the number of patients that will pick up that they know they're on a blood pressure medication, but they don't know which blood pressure medication. And here they're having an exacerbation of their symptoms, their congestive heart failure, and they can't tell you exactly what medication they're on because it was either destroyed or lost during a disaster, or they don't have it with them and when they were picked up. And so this system basically allows us to rapidly identify what medicine that they were on that we need to continue for the patient, and hopefully keeping them from decompensating and getting a lot worse. So big plus.
Yeah, I can see that. Suzanne, I want to go back to you really quick because I mentioned earlier that you talked about emergency census, you talked about ENS a little bit and how emergency census is related to ENS, but emergency census is also related to E+, correct?
That is correct. We integrated the emergency census tool into E+ in February. So now it's kind of, you can think of it as a one-stop shop rather than two separate tools. They're kind of housed together, just, reducing complexity and people having to go to different sites, that kind of thing. So yeah, that was done. That's exciting. I'm excited for for us to be prepared, very prepared this year. One thing I'll mention too is, with these iterations of deploying at least emergency census, we also learned the value of training, right? And contacting the right folks in emergency response to make them aware that it's around. Because I know our first, deployment for Irma, I mean, we didn't even know we had a system with, it was 3 days before it hits, and we're like, oh, how can we use it? Can we use it? Let's see what we can do. And so we stood it up. We figured out that policy piece. We figured out the technical side. But then it was like, oh, do y'all want to use this new tool that we just figured out? And we don't really have a strong, relationship, with y'all. And so that was something I think we learned from that first time, like, okay, we really need to engage emergency response throughout the year, establish some relationships. So we have been doing that, and of course, you talked about Santa Rosa wanting to pilot. And so we've talked to, Dr. Landry probably since December, maybe January, letting us all understand the system, talk about it. There's many little complexities you got to, narrow down. But again, like our third, when we used emergency census, we deployed it a third time for Hurricane Dorian. We never actually used it because, the hurricane just kind of just skimmed by us and we got lucky. But what we had done was already set up training material. Now, this was still more labor intensive, but for that hurricane, we tried to make it a little less labor intensive. And at the same time, we created a very short training manual, and we had scheduled like that. I think it came on like a Friday. That week before, we had 3 different sessions for 30 minutes to get the folks who were credentialed access trained and ready to go. So, those experiences were great. And I think that's going to lend well to us this year, when hopefully a disaster doesn't strike. But if it does, we've got that experience behind us. We know, sometimes things can happen quickly and you're going to have to ramp up quickly for it. And, and we're ready for that. So.
It is very encouraging to see, even in times of disaster, we're able to use that opportunity, those lessons learned, and build upon it for the future. So I think we'd have some great technology in place and great tools in place. I'm going to be looking for those drones, Dr. Landry, to see if I have enhanced cell service. But it's very encouraging. It's very encouraging.
It is. Yeah. And Mandy, did you want to remind people where to go to get information to prepare for hurricane season really quick?
So the AGA website, you'll want to go to the Emergency Preparedness Resources page. It has the ESS information. It has a lot of other useful resources. It has CEMP information. And then there's also the separate site that we have, that generator dashboard, in case anyone wants to see the status of generators in those nursing homes or assisted living facilities.
Okay. And then Suzanne, if there's anybody else that is on listening that wants to participate as a pilot in your E+ service, can they just reach you at that flhii@ahca.myflorida.com email?
They sure can, and we would look forward to it. We welcome anyone who wants to participate and use this system.
And Dr. Landry, I'm going to end with you. Is there anything else you want to share with us about emergency preparedness?
Well, the advancement of technology and you're going to be seeing more and more healthcare being delivered via telehealth. It reduces the need for patients to have to travel either during or before, during, or after a disaster strikes. It's a way to now deliver the doctor to the patient as opposed to having the patient drive off to the doctor. And the use of those drones, I can tell you right now, there's research being done where they're utilizing drones to actually deliver equipment, healthcare equipment, to patients that are in very rural, very isolated areas. And you can essentially consider that or potentially do that in a disaster setting. They're delivering AEDs for cardiac arrest patients by drone. It's potential that you could deliver certain drugs or certain medical equipment. So let me tell you, technology is to the point where you're going to be seeing drones flying, delivering healthcare to patients in areas, in disaster areas, and just in rural areas in general. So the technology is there. Healthcare is being automated, and the telemedicine industry is going to be the healthcare of the future.
Thank you all for being part of today's conversation on health IT and emergency response. We hope you will join us for the next edition of Health IT Matters, Thursday, June 17th, where we will talk with industry leaders about e-prescribing, where we have been, and what the future holds. You can stay up to date on future Health IT Matters episodes and other agency news through our social media pages on Twitter, Facebook, and LinkedIn. Also, if you've missed previous episodes of Health IT Matters, you can now access them through posts on our social media platforms. Until next time, I'm Corinne Slaughterback, and this is Health IT Matters.